Well, you might know the decisions that individual counties make regarding their expected number of COVID cases really depends on a lot of data and several models. Well, today we learned Mecklenburg County is ditching one model after that model's creator says that it was being used incorrectly. Our Joe Bruno is joining us live now. Joe, the county has really been relying on that information.
Erica, for weeks the county has been promoting and pitching the University of Pennsylvania's model. Now they are starting to distance themselves from it. I spoke to the reporter who broke the news about this, WFAE reporter Steve Harrison. Here's a little bit from our conversation tonight.
What did the University of Penn basically say when you started asking them about their model?
So they said that the model should only be used at the very start of an outbreak. And, right at the very beginning when cases are really rising very quickly. And that once you hit peak infection or your cases start to plateau, that the model shouldn't be used.
So Mecklenburg, at first, they were like, we think that we can still use this model, correct?
That's right. Their definition of peak infection was they felt it was the point where there were still more people susceptible to the virus than had been infected. Of course, in Mecklenburg County, that would be 500, 600,000 people. And so I asked the University of Pennsylvania this, and they said, no, that's not the way the model was designed. The model is designed for the very start of an outbreak. And so what happens is each time you run the model, it predicts this huge explosion of cases. And then it allows you to put in some social distancing to flatten the curve. But each time you do it, it's going to visualize or project, simulate this huge ramp up in COVID.
Did the county realize this?
I don't think so. I had the website for the model from the University of Pennsylvania has this notice on it, kind of a warning telling people, look, once you hit peak infection or once you plateau, don't use this anymore. And I'm not sure if they kind of saw that and then continued anyway, but as you know, and we all know, they've been kind of running this model again and again and again, really since early April. And it shows this huge explosion of cases and the hospitals being overwhelmed. And even though predicting the future is very hard, and this is like predicting a hurricane, what's happened compared to the model has been just the complete opposite.
And now the county is saying they're not going to use that model anymore?
That's right. So I said, are you guys going to be doing this anymore? And the health department said they're not going to be releasing any more projections based on this model. Now, it's possible they could still be using it internally and taking a look. But, what's been a feature of their news briefings with the health director has been a rundown of new cases, and then this bell curve presenting what the model is saying. And so we're not going to see that anymore.
It seems like a major change.
I think so, yeah.
Okay, so Meck County saying they will not use this model anymore. What more are county officials saying about this tonight, Joe?
Erica, the county health director, Gibby Harris, released this statement regarding the model. She says, we have used models throughout the crisis and will continue to use them for projections based on available data. However, models are only as good as the data available, and as we've seen across the world, they change almost daily. And while projections are important, we are focused on what's happening here and our recent trends. We'll have a chance to ask her about this model and many other questions that we have during a news conference tomorrow afternoon. Erica.
We know you'll dig in on that. Thank you, Joe. All of this is coming as a leaked report from the White House is listing Charlotte as a potential future hotspot. Now, NBC News first got a hold of this report, which was dated May the 7th. It places both North Carolina and the Charlotte area on a list to watch, saying cases in the state spiked by more than 32% in just 7 days. During that same time in Mecklenburg and nearby counties, cases spiked by more than 268%.